See, now you can see the vocal cord very clearly. Now we can introduce the endotracheal tube. Articles required for the intubations are endotracheal tube of various sizes, 10 ml syringe to inflate the endotracheal tube, oropharyngeal airway, nasopharyngeal airway, LMA, laryngeal mask airway, bougie, stillet, laryngoscope handle with the blade of all sizes, back for the back mask ventilation, ambu bag with mask and oxygen source attached. So this is a 7 number endotracheal tube. So this part is a universal adapter, and here you can see there are markings. Here these are depth markings, and there is one blue line over the endotracheal tube that is called radio opaque line. This is a subglottic suction inflating tube with a one-way valve. This is the tip of the endotracheal tube, and this is called Murphy's ice. So after preparation of the patient, you need to pre-oxygenate the patient for 3 to 5 minutes. So that head tilt. Lift further, open the airway. Keep proper back. The mask you need to keep it proper. This should cover the nose and the mouth and properly seal and start back mask infusion. So during this time, if you want to give any pre-medications, you can administer, and then induction agents like etomidate or propofol, and then paralytic agent like scoline, succinate scoline you can administer. We prefer to give a scoline because this is a short duration of action. The scoline has, it's just 3 minutes of duration of action, so we prefer scoline. But one thing that you need to remember, that scoline, the contraindications hyperthermia. We need to avoid giving scoline in patients with burns and crush injury patients. This is the time that you need to give a proper position to the patient. You can give a small pillow or a roll towel under the neck, so that this position, the sniffing position, enable us to view the vocal cord very clearly. So now we'll start with the intubation. You need to hold the laryngoscope on your left hand. With your right hand, open the patient's mouth, and then introduce the blade into the mouth from the right side of the mouth and push the tongue towards the left. So then advance the laryngoscope blade. You will see epiglottis, and lift up the epiglottis by pushing at the back of the epiglottis. You will see vocal cord. There is one black mark on the endotracheal tube. When you insert the endotracheal tube into the trachea, see to that this black mark should go beyond the vocal cord. Okay, now you can see the epiglottis. Lift up the epiglottis by pressing at the back of the epiglottis. See, now you can see the vocal cord very clearly. Now we can introduce the endotracheal tube. So now you need to inflate the endotracheal tube and attach with the ambu bag. You need to confirm the endotracheal tube placement by oscillating 5 points, 1 on the epigastrium, 2 at the base of the lung, and 2 on the apex of the lungs. So there should be there's filling sound on the epigastrium, and you should be able to hear the breath sound on the 4-point auscultation. And after the auscultation, you attach the endotracheal tube with a ETCO2. See it on the monitor, ETCO2. And if it is the graph is coming, that means the endotracheal tube in place. That means in the trachea. So on auscultation, if bilateral breath sounds are equal, then you can fix the endotracheal tube and see the lip mark and the number. You should note it down so that later on, if any displacement, you will come to know. So, and at the lip level, you need to fix the ET with the ET tape according to the hospital policy. Whatever is available, either a belt or a tape, you can use it. So after the intubation, you need to order an X-ray to confirm the position of the injury.